mynews.studio.
In Malawi, a recent court decision has altered the future for a 14-year-old survivor of rape. It raises the question, can just one legal ruling shift reproductive rights for an entire generation?
Today's date is December 10th, 2025. Let's dive into Malawi. The High Court's decision in AC Minor versus Janala Solomon and others now lets survivors of sexual violence under 18 access abortion. Legally speaking, how big of a shift is this?
It's a major turning point. Previously, Malawi's abortion law was strict, only allowed to save a woman's life. This case forced the legal system to face the realities for minors, especially those who survive rape. The judge found that denying access violates fundamental rights. Still, the big question is whether the broader law will actually change to keep up.
Right, because setting a legal precedent is only part of the picture. When it comes to putting this into practice, are clinics ready? Are health workers equipped to respond? Or is there a risk that communities push back?
Both opportunity and risk exist. The legal ruling provides some protection, but stigma in communities runs deep. Some providers might hesitate, worried about local backlash. For the survivor in this case, the decision meant timely care. But for others, especially in rural areas, access could still fall short.
Let's ground this in a real situation. Picture a rural clinic. The staff may not be fully trained. Resources are limited. Even with the new legal clarity, will a teenager actually know her rights, or will the first person she meets say no anyway?
That's exactly where public awareness becomes crucial. The court's decision is one thing, but if healthcare workers and the wider community aren't informed, the legal victory could end up just symbolic.
Let's shift to Bangladesh for a moment. Their new family planning approach targets remote and marginalized communities. Unlike a single court case, it's a broader, organized effort. What does that look like on the ground?
It's about outreach, getting health workers out to hard-to-reach places, using mobile clinics, and focusing on adolescents and underserved groups. There's a frontline worker in Khulna who walks for hours to reach isolated villages, distributing contraceptives and talking to families directly.
Is the main hurdle there about moving supplies and staff, or is there resistance from the community itself?
It's really both. Infrastructure is a challenge. Think floods, remote islands. But cultural barriers matter too. Some families are wary of outsiders. The approach works best when the health worker is from the local area and can slowly build trust.
And does this targeted strategy mean more young women are actually getting access now?
Early data suggests yes. More young women in pilot districts are choosing modern contraceptives. But to extend these results nationwide, more money and steady political support will be needed.
Now let's look at Kenya. They've introduced new abortion guidelines aligned with the World Health Organization. What's actually changed there?
Kenya's law allowed abortion to save a woman's life, but the details were murky. Now, the Ministry of Health has clarified the protocols, who qualifies, what care is provided, and increased funding for post-abortion care.
But does this lead to real improvements, or does it mostly look good on paper?
There's evidence it does save lives. Clearer rules mean fewer unsafe abortions and better care after complications. A provider in Nairobi told me that before, they'd hesitate to treat patients because of legal fears. With official support, they're now more confident to act.
Though, rural clinics still lag behind, don't they?
Yes, that's still an issue. Some counties are slow to adopt the national policy, and stigma hasn't disappeared. Training and supervision are essential to close the gap.
Let's step back. Countries like Nigeria, Zambia, Zimbabwe, Madagascar, Papua New Guinea, and the DRC have all increased their own funding for reproductive health recently. What's behind this trend?
Partly, it's a response to necessity. After U.S. aid was cut, these countries had to contribute more. International donors helped with an extra $5.6 million, but the core idea is that local investment leads to more lasting progress. Still, is the funding enough for rising needs?
And is that money actually making it to the front lines, or is it tied up in bureaucracy?
That's a persistent challenge. Some places are trying direct facility funding to improve accountability, but others continue to struggle with buying and distributing supplies.
So, with all this happening, are we seeing real progress on maternal mortality and women's empowerment?
Progress is happening, but it's fragile. Legal changes in Malawi, systemic outreach in Bangladesh, clearer guidelines in Kenya, and increased funding in several countries. All these help. But without steady political resolve, community support, and long-term funding, gains can be lost.
For anyone listening and trying to see the bigger picture, these reforms matter beyond health. They touch on equality, education, and economic opportunity. Could more countries follow, or might resistance slow things down?
That's still uncertain. These examples offer practical models with the potential to shape lives for years. But progress rarely follows a straight line. Setbacks are always possible.
Today, we followed advances in reproductive rights from Malawi's courts to Bangladesh's outreach and Kenya's new protocols, finishing with a look at global funding.
Each story shows that even incremental changes can trigger wider transformation, but the process is ongoing. Thank you for joining us as we explored these crucial developments.
Thanks for listening. This episode was brought to you by mynews.studio. Try it now for free.